faced with a potentially life-threatening illness say they're being denied treatments. Sovaldi can stop hepatitis C from causing liver damage, but it's only being given to people who are already seriously ill. The delay in allowing wider use has outraged patients who got the virus from contaminated blood transfusions, and our East Hampshire and Isle of Wight reporter Dominic Blake joining me with more on this. Dominic, tell us more about Sovaldi.
Well, it's a very important new development, Julian. As you say, hepatitis C is a potentially life-threatening liver condition, and this drug can effectively eradicate that in the liver. It's not cheap. It costs £35,000 to £40,000 for a one-off course, which lasts for 12 weeks. And it was approved by NICE in February, and patients were told they could expect it to be available in April. But in an almost unprecedented step, the NHS England argued for a longer delay than that, in fact, a 6-month delay, meaning that it isn't available until the end of July at the earliest, and that means that at the moment the only people who can get the drug are those who are involved in trials or those who are already dangerously ill, Jules.
And Don, what does that mean for patients?
Well, for many it meant a phone call from their consultant to say that they wouldn't be getting the drug, and that's come as a huge shock, and it's caused some anger as well, especially amongst patients who caught hepatitis C in the 1970s and the 1980s when the NHS gave them contaminated blood transfusions. Now, Sovaldi could stop hepatitis C in its tracks and offer them the chance of a healthier, longer life, but now they face a long wait, uncertainty and the risk of complications developing in the meantime.
And what does NICE have to say about this?
They sent us a statement which said it's clear that this drug marks a step change in the treatment available to patients with hepatitis C. We have recommended its use because it's clinically and cost effective, but having done so, we have to be very careful about introducing any delay in patients gaining access to treatment from which they might benefit. However, we also need to avoid placing the NHS in a position of confronting a significant tide of expectations from patients for access to care which they don't feel equipped to provide. They say that would risk suboptimal treatment decisions and may even place current service provision under an inappropriate level of stress.
And NHS England, I know they've been talking to you as well, haven't they?
Yes, that's right. They said that they welcome the agreement from NICE to grant NHS England time to allow formal clinical networks for hepatitis C to be established in order to ensure that people have equal access to care. They say that they'll be publishing those plans in due course, and in the meantime NHS England, it says, has been operating an interim commissioning policy on these drugs while NICE has been considering the guidelines, and that's to ensure that those in the greatest need have been able to access those treatments, and they say in the meantime, and they say that they've made an additional £38 million available in the last financial year to fund that care for patients most at risk of liver failure.
Well, listening to that is Jackie Britton from Porchester, who was infected with hepatitis C after being given a contaminated blood transfusion at St Mary's Hospital in Portsmouth in 1983. Good morning, Jackie.
Hello.
Thanks for being there this morning. I'm just listening to those statements there, full of kind of health speak, like suboptimal treatment decisions, whatever that means. So, I mean, Jackie, tell me about yourself and how you've been coping.
Not very well since I had the phone call from King's a week Friday. As I say, I've been waiting on a phone call to say, come up to London, you're starting treatment. I've been actually waiting 2 years for treatment since I failed the treble treatment. So for that 2 years, every 6 months, I go for a cancer scan. So obviously from 1 6 month to the next, each time the cancer scans come up, you're worried whether you're going to get another positive result and everything's okay. We're twice at risk, more at risk than other people once we've got the cirrhosis of going on to have other forms of cancer. I just need to be on treatment now, not in 6 months' time where the delay could cost me my life.
And just to clarify, you were infected with contaminated blood during the birth of your child back in 1983, weren't you?
It was afterwards, yes. Okay. She was 9 days old and I had a hemorrhage and had to have 4 units of blood.
Right. And Jackie, so have I heard this right? You were basically expecting to have this treatment and then at the last minute you weren't. Have I got that right?
We were expecting from the 3-hour debate where Jane Ellison said that, come April, people with cirrhosis would be able to gain access to the treatments.
And who's Jane Ellison? Sorry to interrupt.
She's the health minister.
Thank you.
So we've got that in black and white. We've also got it on camera. And all of a sudden, as I say, you get your hopes up. I've been waiting 2 years already with no treatment. So my cirrhosis is getting worse day by day. The chances of my getting cancer are getting worse day by day. So I'm prepared to go on any drugs with whatever side effects, and I don't see why, being as they've infected me in 1983, they don't pay to try and help cure me.
And what do you make of those two statements from NICE and NHS England?
I've had this from the time I was diagnosed in 2011. I've had to fight for all of the treatment I've had. I've had 2 rounds of treatment, and each time I've had to get an MP involved, in my case Mark Coburn, to try and get me on the treatment. It's about finance the whole of the time. This whole situation started 30 years ago because they didn't pay for clean blood. It's decimated the haemophiliac community. It's decimated families that have had blood transfusions. I was not only at risk. Once I was diagnosed in 2011, my husband had to be tested, and so did my second daughter. Luckily, they were both negative, but if my second daughter had been positive, then my granddaughter, who was 6 years old at the time, would have had to have been tested.
So it could have gone down the generations.
That's right.
Yeah,
it's and I know people are saying Penrose is a whitewash. It was. For the cost of it, I think it was awful. But the one thing that came out of it, which I hope to God the English government take on board, is that they are now going to be testing or asking people to come forward for tests that have had transfusions. That's what needs to happen.
Jackie, we're going to leave it there. I want to thank you so much for joining us today, and let's hope some progress is made on this.
In short, Julian, NICE says that it recommended the use of this new drug, Sovaldi, but agreed to delay its introduction until July so that hospitals could prepare for the expected demand. And NHS England says that delay will help to ensure that people across the country have equal access to care, and that while all this has been going on, all these discussions and approvals and delays, while that's been going on, it's been operating an interim policy and made £38 million available so that those at least with the greatest risk of liver failure have been able to get the drug in the meantime. But this delay, the drug was supposed to be available, patients were told around about April. This delay means uncertainty, and of course all the time that they're not getting the drug, there's the risk of complications of liver disease, things like potentially liver cancer. So it's a worrying time for these patients.
So Sally, for you, you're now nearing end-stage liver disease. You have to live off banana milk. What do you make of those statements?
Load of rubbish.
What do you want to say to the powers that be?
I want to say to the powers that be, 30 years ago, you gave X amount of people, because realistically, we can count the figures that we definitely know, but the figures roughly strewn about that we're not quite sure of about 37,000 people.
Yeah. Tens of thousands of people, that's the point, isn't it?
Yes. Yeah. I want to say to them, cough up. All right, it's not all about money, but what people do not realise, and I really want to reiterate this, is people like myself haven't worked for a long time. We cannot work. It's not we don't want to. I'm ex-military. I worked for the government. I became so ill that I had to leave the government. I was on sick for 18 months. And I tried desperately to stay there.
And to be told in these statements that basically they're going to wait a few more months until they've got enough to go round for everybody.
I was just going to reply on that exact thing.
Exactly.
I was told by my heptologist, sorry, I've got so many doctors, heptologist and my hep nurse, they were so excited for me. I've waited 10 years for treatment because of my bloodborne disease. My own disease. I cannot take the old treatment. It nearly killed me in a week.
Right.
So I've waited 10 years for this new treatment.
And you're still waiting.
They finally said, no, they told me in January this year, we're dead excited, you can have it. I said, you're joking. But what they haven't said in there is they've made a point system. You have to have, there's a measure on your illness. There's a point system. You have to be 50 points to get this treatment on their grounds. Now, I have cirrhosis. I'm about 49.1 points. My Hep nurse, bless her heart, is desperately trying to find those other points so I can get the treatment.
Should it be like this? Should we be putting point, you're just 1 point away from being the 50 points, or less than that, actually, having heard that.
Yeah, less.
Which is crazy, isn't it?
Why do they not say between 45 and 50? Because that is a lot of range of a lot of people who've got cirrhosis.
Yes.
And you see, with the haemophiliacs, they can't prove they have cirrhosis, a lot of them. Because to have what they consider acceptable test would kill them, because you have to take little bits out of your liver and they'd bleed to death. So is this acceptable? No, this is not acceptable at all. And I would like them, to be honest, to cough up. It's too little, too late.
Sally, I'm going to leave it there for the moment. I'm sure you and I will be talking again, and I hope next time you're on the show it's with some good news rather than this rather depressing story we've had this morning. I'm very grateful to you, though, and we're thinking of you and lots of love.
Thank you.
Cheers, Sally. Sally